We've been talking with you a little bit this morning, kind of give you a little tease about what we want to talk about with Dr. John Kosmeh this morning. It'd be nice to get medical attention and not have to leave your home. Now you can, thanks to RemoteMD. And Dr. John Kosmeh is part of that. He's on the phone with me right now. Doctor, good morning to you. How are you?
Doing great, Jim. How are you?
Doing great. Welcome to a Thursday morning broadcast. Sorry the weather conditions are preventing us from getting together face-to-face, but I'm happy you're willing to do this over the phone. I wanted our listeners to learn more about this opportunity because I think it's fantastic for this area. Tell us exactly, if you will, what is RemoteMD?
Well, RemoteMD has been a company that is based out of New Orleans, international medical company. We've been dealing mainly with offshore gas and oil industry and been using telemedicine for roughly about 15, 20 years. We started in that industry to help with gas and oil companies to reduce the unnecessary amount of medevacs that they were experiencing. You know, prior to us coming in there and creating a program, if somebody gets sick on an oil rig, even if it was something minor, small ash or something along that lines, they had to be medevaced off there. And you can imagine the cost of that. So being based out of Louisiana, New Orleans, we were pretty in the middle of gas and oil, if you would, a big hub down there. And they came to us and asked us what we could do to try to help reduce that. So we actually created a telemedicine program long before telemedicine was even a thing. And was very successful in that. We are now one of the leaders for medical control and placing medical personnel for the gas and oil industry.
I can see how that would be a great benefit to a place like that. And fortunately, you guys were already above the curve on those kind of things. How can our listeners in this community of Rutherford County and Polk County, how can they benefit from something like this?
Well, what happened was when COVID-19 hit, obviously there was a lot of concern in capital for interruption into the economy with gas and oil. So we attended several meetings up in the Hill, and one of the questions that were asked to us is how do we prevent COVID-19 from interfering with the gas and oil industry and causing more damage to the economy here in the United States? So we were tasked with putting together a program to prevent COVID from getting into the offshore industry, and we did that. We were very successful. We did not have one positive COVID case that came through our program hit the gas and oil industry. So Washington kind of looked at that. They invited us up. We were recognized for that. And while we were there, had an opportunity to speak with some senators. We had a few conversations with Senator Tom Tillis, who is here in North Carolina, incredibly concerned about healthcare and delivering healthcare to the residents of this state. One of his big issues that he was working on and concerned about was rural communities in North Carolina. How many hospitals have been closing down, and how do we deliver medical care to these people who are an hour away or 2 hours away from hospitals or medical facilities? And how do we make it affordable for people who have high copays or high deductibles or no insurance at all? That was one of his biggest things. When we had conversations with him, he kept mentioning over and over again, I need to get residents in North Carolina taken care of in healthcare. So we began to work on that, and we took our ideas and our platforms from offshore, and we created a telemedicine program that's now available here in North Carolina for residents. We have a lot of different programs for veterans, for college kids, for small families, for large families, where now you simply log on to the website and you'll speak with a experienced emergency room RN. The first thing is to make sure this is not a life-threatening situation for you, something that needs 911 or may need an emergency room. And once we determine that, we'll go ahead and we'll initiate that visit. You'll speak with the RN. At that point, they'll do a triage. They'll put you on hold for a minute, and then you'll be speaking with a licensed physician who will do a virtual visit with you. And if we need to send out some prescriptions, we can e-script those out to your local pharmacy. You go pick them up. It's a fraction of what it would cost you for a copay or time to make an appointment or go to an ER and sit in an ER room waiting to be seen. And our average call is about 22 to 27 minutes right now.
I can see how folks who just don't feel like getting out of the house to go have themselves checked, but it's nothing really serious that they think about. I can see the benefit of calling in this program and being diagnosed right there on the phone.
Yeah, absolutely. The flexibility and just the convenience of it. I'll tell you a story. We had a young lady who called us, I believe she was up in Massachusetts. Her 8-year-old daughter woke up with a very bad earache. She was able to log on, not have to bundle the kids up, not have to go out in snow. Closest hospital, by the way, is 45 minutes to her. And she was there herself 3 weeks prior and had a 4.5-hour wait in a hallway bed rather. just because of how busy this hospital was. And that's a problem across the nation. I mean, hospitals are just understaffed, and people use it as their primary care, and we all know about the bottlenecks there. But she was able to log on to our website with 38 minutes from start to finish. We were able to see her daughter, diagnose her daughter with minor ear infection, called in her prescription to the pharmacy. She went and picked that up at 9 o'clock the following morning. 2 days later, sent me an email just praising how great the service was, how much she appreciated the help she got, how professional everybody was, and cost her half of what it would have cost her to go into an emergency room, pack up 5 kids and her sick daughter, go into the emergency room and wait several hours. So stories like that, and we get those all the time, that just absolutely we love to hear. And, you know, one of the things we constantly say is there's a lot of telemedicine companies out there who are technology companies trying to do medicine. We're a group of medical providers using technology. And our goal is just to provide medical care to everyone across this country at an affordable rate. It needs to happen. Our medical system's been broken for a long time, and we need to make some changes to make sure that everybody gets the quality care that they need.
Sounds like, and correct me if I'm wrong, it sounds like those who would call into this will have access to multiple specialists, not just a doctor or just a nurse. Am I right on that?
Absolutely. Yeah, we have cardiologists, pulmonary specialists, behavioral health specialists. We can handle any type of medical issue that people have going on. Now, obviously, you know, if you're having an acute chest pain and numbness in your arm and some cardiac issues, that's not something we're going to handle on a virtual call, right? That's something that you need to be face-to-face with a physician, getting some diagnostics done.
But you can tell them, you can tell them that in the conversation on the phone. You can tell them that, though, right?
Oh, absolutely. You know, if that were the case, and, you know, we've had people call where there was a possibility of cardiac conditions going on, and our nurses will tell them to immediately call 911, and they'll stay on the camera with them. They'll stay on the virtual call with them until EMS gets there. But, you know, there are certain things that you are going to need your hospital for. We're not taking place of the hospital. We're not taking place of your insurance. We're just for the unnecessary trips to the ER. You know, we're the perfect solution to that. And we have programs, you know, I'll give you an example. We have programs that we work with, assisted living and senior nursing facilities, retirement communities. You know, Medicare estimated that last year over 70% of the transports to emergency departments and emergency rooms from those types of facilities were unnecessary. 70%. I mean, that is a huge, huge amount. And when you think about the cost of that, not only to the facilities, but to the patients, you know, it's overwhelming. So we developed a program where we're working with them. We have over several states, large organizations that work with us on that. We send out, you know, equipment. We have Bluetooth equipment. We can do EKG, 12-lead EKGs. We can do ultrasounds. We can check blood pressures, temperatures, heart rates. And all of that comes right into our physician portal. Our physicians see that in real time. So they're able to have a full diagnostic outlook on the patients, and we're able to treat many of those and keep those 70% of unnecessary transports in the facilities where these residents are comfortable. You know, that cost taxpayers over $2.6 trillion for healthcare services in 2010, just for that alone. So, you know, our goal not only is to create a positive experience for our patients, but also to try to decrease the burden of healthcare throughout the communities and throughout the United States.
I know a number of people who talk with me from time to time about how frustrated they are with the insurance coverage that they have, with the copays, and it seems like they go through maze after maze after maze to get all that clarified. Through this program that you're talking about, it seems like that can eliminate some of that copay confusion.
Absolutely. So we have several programs set up. You can do a pay-per-call where you just call in, pay one fee, and you'll be seen by the physician. We also have several subscription plans set up, Jim, where if somebody is interested, they can log on to the website, pay a monthly fee. They start at $59.99, and that's for unlimited visits. So you use that as many times as you need throughout the entire month. It's one cost. There's no additional copays or deductibles or anything else that needs to be paid on that. And it's a 24/7 service, 365 days a year. We're available. So starts at $59.99 for veterans. We have programs for college students, parents who have kids who are away at school. We have a special program for them where they have unlimited access to the service. So if they're away from you, you know, a lot of the colleges have clinics, but they're only open certain hours and not on weekends. So this is an opportunity for you students to be able to log on, see a physician, see a nurse right there. Also have programs for families up to 4, families 5 and more. So it's incredibly affordable. And, we're able to do that because it's virtual. We're getting rid of the brick and mortar building. We don't have that type of overhead. So our physicians are able to do it at a much lesser cost than if you were to go to an ER or have to wait to make an appointment to get into your primary care physician.
One of the other things I was impressed with, Dr. John, as we were talking, that if there is a need for a prescription service of medication for whatever the reason happens to be, you can just phone that right into the druggist, and they can get that filled instantly. I like that accessibility.
Correct, yeah. So if there's a prescription that needs to be sent out, we'll e-script that over to the pharmacy of your choice, and they'll fill it right there for you. I will say this, as a company, we will not prescribe any narcotics over a televisit or a virtual visit. That's something that we feel that you need to be face-to-face with the physician for. Any type of antibiotics, things along that lines, we're more than happy to call those in, e-script those to the pharmacy of your choice, whichever pharmacy is closest to you. The other great benefit of that is if you're traveling, you're on vacation, we can e-script something over to a pharmacy that's close by to wherever it is that you're staying.
You talked about college students and veterans, how beneficial it is, and I see a great benefit for seniors who at home don't have the mobility of going to the doctor when they feel bad or have something going on. It seemed like a great godsend for them. Now, what's the best way for folks to get involved in this program?
So all our information, Jim, is right on our website. You can go to www.RemoteMD, that's RemoteMD, one word, .net, N-E-T. So it's www.remotemd.net. All our information is right there, and you can actually access our waiting room right from that website as well.
It seemed like a wonderful opportunity for folks to go through this process of wondering what's going on. I feel this way in my ears. In calling this process, John, it seemed like I can see it being very beneficial to just about any age group.
Oh, absolutely. We'll see everybody from pediatrics, any age we can handle, and certainly we'll conduct a visit and give you fantastic medical care.
Again, that's www.remotemd.net.
That is it, yes, sir.
Is RemoteMD capitalized or small letters? Does it matter?
The R and the M and the D is capitalized, but it won't matter when you log on. It'll get you to the website, no matter how you put it in there.
Okay, great. It's been very interesting and very eye-opening for a lot of folks, I think, and I'm glad we had the opportunity to chat briefly earlier in this morning, and I'd love to have you back sometime to expand this even further.
I would love to. Anytime, Jim, anytime.
Thanks so much. Dr. John Kosmeh, my guest this morning with RemoteMD, a great flexible program for all of us. Have a great day.
Thanks, Jim. You too.
I thought that would be very interesting for you, my listeners, to know more about that, because I know there are a lot of frustrations about copays and policies and coverage and getting in to see the doctors and the nurses and the waiting period and can't get there because of transportation. A lot of reasons why this might be beneficial, so look into it. That's www.remotemd.net and learn more about it. And I'll be back in just a moment.